My name is Blake Dinius, and I'm with Plymouth County Extension. I work as the Entomologist Educator for the county. There's a lot of misinformation that's floating around nowadays, so being able to act as someone who can weed through all of that misinformation and give people the correct knowledge, that's really the primary role of this job. And I really like it. One more down. We're at Reedy's Archery in Middleboro, and this is just one of a few check-in stations, essentially in every county throughout Massachusetts, that UMASS Amherst has requested that people kind of stop by and collect ticks off the deer coming in. We're doing two things. We're going to be collecting the engorged female ticks because they'll be used to replenish the colonies that they have on site. And we're also collecting any other ticks for a method of surveillance. So some of the things that we're looking for are Lone Star tick, which we haven't seen in Plymouth County yet. And we're also looking for potentially the Asian longhorn tick, which we know has been seen in neighboring states like Connecticut and New York. Right now, as much research as we can conduct is going to help us learn more about fighting the diseases that are out there and protecting ourselves against ticks and the diseases that they carry and transmit to people. But what a lot of people don't realize is that we see Lyme disease cases year-round. And so this particular time of year, it's really important to do things like wear long pants, closed-toed shoes, that kind of thing, because the adults, as we mentioned, are going to be seeking out the blood of a large mammal, and we're large mammals as well that they would easily want to cling to. Can't forget tick checks on your pets and wearing tick protection on your pets year-round. Sometimes people say, I don't want to treat my dog for ticks and fleas now, it's the winter, but it's a really good time to do it this time of year too. If you find a tick that's embedded in feeding, what you want to do is you want to take the tweezers and you want to press them up against your skin and you want to pull straight up with steady force. But it's just slow and steady pressure, don't yank, don't twist. I know you want to get that out as quick as possible, but you want to keep that tick intact. And after you do that, you can send it out to the UMASS Amherst Laboratory of Medical Zoology, the same place that we're conducting this research at, and they'll test that tick for you and they'll tell you exactly what diseases are in it. And one of the reasons to do that is for peace of mind. If it comes back with no diseases, that's kind of nice to know. Or a co-infection, what else is in that tick? Is it Lyme, just Lyme, or is it Lyme and babesiosis? You might want to know about that. And the third reason, which is kind of more of an unselfish reason, is that knowledge, that information that they're collecting from that tick is going to then contribute towards this level of this research, this passive surveillance that they're collecting at UMass Amherst as well. So you're contributing to the scientific community as well by doing something like that.